Hey there, this is Luis Moreno with Simply Health Insurance Agency. Guys, I have a question that get asked of me from a lot of insureds, and that is, can you explain how the deductible, the coinsurance, copays, and more importantly, the most important part of a health insurance policy, of an ACA policy, is the maximum out of pocket. How do all four of those things apply to a maybe $100,000 bill that I get in a hospital? I'm going to explain that to you guys. First thing I want you to do, guys, watching this on YouTube, do me a favor, like this video, give me some comments, and then subscribe. I will definitely help you out if you're needing some health insurance. All right, so let's talk about how these four parts of a health insurance policy help you in understanding what you could owe if you have $100,000 bill or maybe even $1,000,000 bill at the hospital. So I'm going to draw this out so I can explain it. It's a lot easier for me to draw it out than to just verbally tell you what that's going to be. All right, so I'm going to share this sketch pad. So we're going to make some assumptions here, guys. So we're going to assume that the plan that you're on has $1,000 deductible. And we're going to assume that the coinsurance is 80/20. And these are percentages. And the coinsurance, that first number, the 80%. Now there's 70/30s, there's 60/40s, or 50/50s. What this means is that first number is what the insurance company is going to pay. The second number, which in this example is 20%, this is what you're going to pay. And then the most important number to know in a health insurance policy is what is your maximum out of pocket. And in this scenario, I put $9,000. So we're just making an assumption here for you. So let's go take $100,000 bill at the hospital. Okay, be any facility, it doesn't matter. Just we take this bill. Now, the first thing that's going to happen is you're going to pay the first $1,000. This works just like your car deductible or your home deductible. This is what you have to pay first before the insurance company pays anything. Okay, so you're on the hook for the first $1,000. Now, there is an exception to this rule. In your policy, more than likely, you have what's called copays. And these are specific dollar amounts. Maybe when you go see a primary doctor, you pay a $10 copay to see a PCP. Maybe when you go see a specialist, you pay $25 to see a specialist. This is another copay. Maybe you go to urgent care and it's $50. Okay. Maybe you go get some prescriptions, and maybe your generic prescriptions, can't spell generic, but that is generic right here. Maybe your generic prescriptions are $10 copay. Okay, so these copays, you don't have to worry about the deductible, coinsurance, or the max out of pocket. Okay, you just pay your copay and you're good to go. Let's go back to this hospital bill of $100,000. Now you're going to pay the first $1,000. That leaves $99,000 left over. Now you're going to take this bill and you're going to split it on the coinsurance, the 80/20. Remember, this is a percentage. Okay, this is your co-insurance. Every plan, whether it's an individual Obamacare plan, if it's a short-term medical plan, if it is a group plan with your employer, you're gonna have coinsurance. Now, there are some plans that are 100% coinsurance, which means after your deductible, you pay nothing. But those are expensive plans. In Obamacare, we don't have that. So if you have an individual ACA Obamacare policy, you're not going to see a 100% plan. So what you're going to see is this 80/20. Now, you're going to pay, this is a little scary here, guys. you're going to pay 80% of, or the insurance company is going to pay 80% of the 99. You're going to pay 20% of that 99. Now you're probably thinking, so I got to pay 20% of 99,000. That's almost 20 grand. Let me do the math here. Times 0.2. That technically is $19,800. That is what this 20% equals to. But remember, you have what's called a maximum out of pocket. And what this means is this is the most that one person will pay in one calendar year. So let's take the 9 grand, okay, which is your worst case scenario. You've already paid $1,000 in the deductible. Okay. So if this is a bucket and we're trying to fill it up to 9,000, you've already paid $1,000 in the deductible. Now the rest of this bucket is going to get full of your coinsurance money. So when you add an additional $8,000 to this bucket, you have hit the top of the bucket. You're done. You've satisfied that maximum out of pocket. So when you've reached 9 grand, you're done. Even though 20% of 99,000 is 19,800, you don't have to keep paying beyond that. You only have to pay up to the 9,000. It is important to know that in Obamacare, the deductible is part of your maximum out of pocket. There's plans out there where the deductible is not part of it. So you have to do the calculation for the deductible and the calculation for the maximum out of pocket. You add both of those up and it gives you one big number. It's a little crazy. That's what happens with short-term medical plans. And a lot of insureds don't know that. Okay. So on an Obamacare plan, the $1,000 is added here. It is added to this bucket. So you know that once you hit the 9 grand, you're done. You don't pay anymore. You have satisfied that requirement. Now, once you've satisfied that 9,000, you're done. For the remainder of that calendar year, you don't pay anymore. You're done. So your medical is covered at 100%. So pretty neat little feature, but you as insureds have to be ready to have the money to pay that maximum out of pocket. Now, we insurance agents, we have solutions for you. We can help you with that maximum out of pocket of whatever it may be with an indemnity plan. I've got an indemnity plan that will give you 9 grand in reimbursement if you're in an accident, or it will write you a check for 9 grand if you're hospitalized for 24 hours. Okay, so that's where we come in and we help you with that. So just know that the 4 major parts of a health insurance plan is the deductible, the coinsurance, the maximum out of pocket, and then you'll have copays for doctor's visits and for prescriptions. You may have some copays for some other things, but this is where you've got to study your summary of benefits and coverage that you should be getting when you enroll in a plan. Hope this was helpful. Guys, I have my information down below. I've got my email, my phone number. If you find that this was educational, please let me know. If you're needing help with your health insurance, it's going to be a crazy couple of years with rates and a lot of the political changes that we're dealing with in the individual health market with the marketplace, which is Obamacare. Then contact me. I would be happy to help you. Now, again, my email's down below, okay, and my phone number. Give me a call, send me a text, send me an email, and I'll be glad to help you out. This is Luis Moreno with Simply Health Insurance Agency.